Hello friends, let us now learn some important points about the apoptosis or programmed cell death. So, in apoptosis or programmed cell death can be divided into two types. Apoptosis or programmed cell death occurs due to two types. One, it can occur due to intrinsic pathway or extrinsic pathway. So, in intrinsic pathway, it occurs in mitochondria. The issue in intrinsic pathway is mitochondria, and growth factors are mainly the things. So, first let us draw mitochondria. So, that is mitochondria. We have BCL2 present in the mitochondrial wall. So, normally what happens is there will be growth factors which will activate the BCL2, and thus this will stop or decrease the mitochondrial permeability. So, whenever there is apoptosis decreases the growth factors which will decrease the BCL2 activation. So, this BCL2 is replaced by BAC or BAX. This BCL2 is an anti-apoptotic factor, and this BAC or BAX is pro-apoptotic factor. Whenever there is decreased growth factors, there is decrease in anti-apoptotic factor and there is increased in pro-apoptotic factor. So, an anti-apoptotic factor, which is BCL2, is replaced by pro-apoptotic factor, which is BAC and BAX. Now, because this is a pro-apoptotic factor, it increases the mitochondrial permeability. So, because of increase in mitochondrial permeability, so in the mitochondria there is an enzyme called as cytochrome C. So, this cytochrome C is released from the mitochondria into the cytoplasm. Cytochrome C is released from the mitochondria into the cytoplasm. So, this decreased mitochondrial permeability also causes release of SMAC diablo SMAC or DIABLO, SMAC diablo from mitochondria. There is release of SMAC diablo from mitochondria. So, whenever there is release of cytochrome C from the mitochondria to cytoplasm, cytochrome C present in the cytoplasm will combine with APAF1, and both this cytochrome C in the cytoplasm and APAF1, this complex will activate caspase 9, which is the initiator caspase of apoptosis. This caspase 9 will activate caspase 3 and caspase 7, which are executioner caspases, and these caspases will increase the proteases and endonucleases. Thus, these will result in cell death. Right? Now, this SMAC and diablo will activate the neutralized inhibitors of apoptosis. So, they will stop they will block the inhibitors of apoptosis. So, they are also pro-apoptotic. The second pathway is extrinsic pathway, which is Fas ligand and CD95 ligand. This Fas ligand combines with CD95 Fas ligand, and we also have trail, which will combine with DR4 and DR5. Both these will cause trimerization of FADD, that is Fas associated death domain is activated along with procaspase. Fas associated death ligand is activated due to the trimerization of Fas ligand. So, this will convert the procaspase 8 to caspase 8. Remember, this procaspase 8 is not present in humans. So here this will activate procaspase 10 to caspase 10 in humans, which is the initiator caspase of extrinsic pathway, which will again activate caspase 3 and 7, which are executioner caspases. So this is the trimerization, that is 3. They become thrice. Okay, three components of fast ligand will combine together to form trimerization, which will activate the procaspase and fast associated death ligand. So these are the important points about the apoptosis. Some important one-liners are: caspase 3 is the most important executioner caspases among caspase 3 and 7. Caspase 3 and 7 are executioner caspases, most important being caspase 3. Caspase 9 is an initiator caspase of intrinsic pathway. Caspase 9 is initiator caspase of intrinsic pathway. Initiator caspase of extrinsic pathway is caspase 8. So, if you were asked about one question about the regulation of apoptosis, it is very important. Regulation of apoptosis. The BCL2 family gene is present on chromosome 18. BCL2 family gene is present on chromosome 18. So apoptosis can be pro-apoptotic factor, anti-apoptotic, or sensors are also present. Anti-apoptotic factors are BCL2, BCLXL, MCL1 and sex steroids. These will increase the inhibitors of apoptosis, and thus these will block or stop the apoptosis. Whereas pro-apoptotic factors like BAC gene, BAX, P53 gene and BCLXS gene, all these will increase the cytochrome C, which will activate apoptosis. Sensors like BIM, BID, BIM gene, BID gene, BAD gene, PUMA gene and NOXA gene. So BIM, BID, BAD, PUMA, NOXA gene will balance the apoptosis. So we call them as sensors. So these are the important points about the regulation of apoptosis. Now the next are examples of apoptosis. As we have already discussed in the last class, apoptosis can be either physiological and pathological, whereas necrosis is only pathological. Physiological examples of apoptosis are: in embryogenesis, there is lots of cell removal occurs through apoptosis. In menstruation, endometrial cells are removed through apoptosis. Virus infected cells, neoplastic cells, that is tumor cells, are removed by cytotoxic cells by apoptosis. Pathological apoptosis include councilman bodies like viral hepatitis, graft versus host disease, gland atrophy following duct obliteration in cystic fibrosis, gland atrophy following duct obliteration in cystic fibrosis, and pathological apoptosis is also seen in retinitis pigmentosa, where there is apoptosis of rods. So these are the main examples and process of apoptosis. Thank you guys for watching my lecture. Thank you.